in English. Uh, Hello, everyone. Thank you for joining us to this webinar that we are organizing in coordination lodging with MindPlace, which is titled PACE for Essentials of Mental Health in Study Abroad Prevention, Adaptation, Connection, and Emergency. The first thing that I want to do, I kind of briefly explain you the reason of this session, this webinar. And why is that a company like Lodgering that traditionally, at least in the top of mind of many of you, is a housing provider, it's organizing this type of webinars. It is true that we were a marketplace for housing, but we have evolved, and right now we are a digital ecosystem of organization that provides value services for international mobility, support services for programs, students, etc. And among all the type of value services that we provide, apart from accommodation, it's linked to our motto. It's that we do care, because we have the idea that the studying abroad is not just an academic experience, it's also a life experience. While you're abroad, you are not only going to university, you are living in a city, you are living in a place, you need to feel like you are at home. And to feel at home, you need certain support. And that's why we have built an alliance with different experts in different fields that work in coordination with us. And in this first occasion, we want to introduce you one of our very well reputed experts in the field, MindPlace, which is led by Leticia Martinez. Leti, among friends like we know from a long time. She's an excellent expert in the field, and she's an excellent professional as well, and a nice person, which is probably most important. So, saying so, I will let Leti to guide us into this webinar.
Okay, thank you very much. Thanks, Saul. And thank you for your words and your presentation. It's my pleasure to be here. Thanks to Lodgering as well for having me here today. I feel very proud of this collaboration that we have with you, because I didn't tell Lodgering that I was going to say that, but it's true that their slogan is like, we do care, and they really care. They really care about the mental health of their clients. They really care about the mental health of the students that they are studying abroad. For us, it makes our work much easier, and it's our pleasure to collaborate with them. And as I was saying, we know each other from a long time ago, so it's always nice to collaborate and to meet here. And seeing some familiar names here, some of you that you already know me, but for the rest of you that you don't, my name is Leticia. I'm a clinical and health psychologist, but I think that we are not seeing the slides.
Sorry.
No, sorry.
No, sorry.
No worries. It's fine.
Sorry.
Here we go. Fantastic. Thank you. So as I was saying, my name is Leticia. I'm a clinical and health psychologist. I work at MindPlace. MindPlace is a multilingual and multicultural center. And I emphasize the part of multicultural because I think that when we help people that they are coming from different cultures, it's not just important to manage the language. All our therapists, they speak different languages, but also to understand cultural differences and to be cultural aware of these differences, these similarities that different students they have. I also work as a professor at Syracuse University here in Madrid and IE Business School. And today we are going to talk about mental health while studying abroad. We're going to talk about mental health and study abroad, how this field has been changing lately, probably something that you already know. And later we're going to go to each of these different steps. Those of you who know me, you know that I really like acronyms. I like them both in therapy or okay, you can hear me again. Fantastic. So as I was telling you, I love acronyms, and I do in therapy or when I'm teaching, because I think that it helps us to remember things better. I know that lots of you work in different programs or in residencies. Some of you work in programs that you collaborate with us, with MindPlace. And I know that you're in general very busy doing lots of different things at the same time, having different hats, different roles. And that is important to give you information that you can remember easily. So that's why this acronym about prevention, adaptation, connection, emergency, and finally, we will have time to talk, to ask your questions, and to reflect all of us together. I'm going to give you some of the advices and some of the things that we know from MindPlace, and in my case, from more than 10 years working in this field. But I'm sure that you have your own ideas as well, and you know different resources and practices that they have been very helpful for you. So it'll be great if we can share with each other and we can learn from each other. Next slide, please. As I was telling you, we're going to talk about how this field has been changing. And in the last years, studying abroad, maybe we could say maybe the last decade or something like that, we are seeing a very big change in students, their priorities, their personal strengths, their personality traits. To give you an example, here you can see a picture of Retiro Park, Parque del Retiro in Madrid. And it's because probably when they were coming here maybe a decade ago, they were very focused on the city. Madrid, Barcelona, Valencia, Florence, Milan, wherever, they were very focused on the city. They were coming for maybe more than 1 year or 1 year or at least one academic year, and they were very doing an important deep dive in the culture. Some of them living with host families, learning the language. But what we are seeing, and obviously I'm generalizing, there are exceptions, but what we are seeing lately is about students that they are traveling. When they come, they are traveling around Europe. Sometimes it's difficult that they spend more than 2 weekends in the city in which they are studying. We are seeing that programs they become shorter and shorter, programs of 3 months, 2 months, 5 weeks, 4 weeks, and it creates also different expectations. It creates also different priorities, different strengths, but also different issues. And we also see that they start to be much more impacted by technology and the social comparison with other people. They can spend the whole semester here without learning a word of Spanish, Italian, French, wherever they are. And because they are very connected to their social media, their technologies, these things, are they good? Are they bad? Probably they have positives and negatives. Probably we have more students nowadays, and probably it's becoming more affordable to study abroad. But at the same time, these differences, they come with different challenges, and that is what we are going to see today. We're going to talk about challenges and potential solutions. Before to continue, just let you know that of course we will have time at the end of this presentation to share, to talk together. But if you want to interrupt me, if you have any doubt, question, you can raise your hand and you can participate, of course. So don't be shy, and feel free to let me know about your thoughts and any questions you may have. Next slide, please. I like to begin always with a bit of data about what we're talking about when we are talking about mental health and study abroad, because it's a topic that we are talking about more and more and more. And even if it's more prevalent, even if we are seeing more mental health issues, and especially we have much more mental health awareness, we also know that it's not about the majority of students. I just want to give you some data about our statistics, but if we compare them with literature, when we are doing literature review, when we go to science or different databases, we see things that they are very similar. As you can see here from our data, that's why we are always asking you about how many students do you have this semester, and later we see how many they ask for help. But what we know is that around 12.5% of students, they seek help related to mental health issues. This is the data that we have from the last year. As you can see here, a sample of close to 170 students, more than 1,000 sessions. But as I was telling you, when we compare it with other clinics or when we go to the literature, we see very similar data. As you can see here, also the average of sessions that they have during a semester is approximately 6 sessions per student. Some of them, maybe they have 3 sessions because it's a little problem that they have and we can solve it. Others, they need more help. But these statistics, these 12.5%, it's also very similar to what we see in general population. Sometimes we are biased because maybe we work with the students and we think that they have more problems than the rest of people, but it's not completely true. It's also true that this data could be biased because there are people that maybe they need help and they don't ask for it, or maybe they continue with their therapies at home. I think that is less common because of legal issues, but it's true that there are people that maybe they are not asking for help and they need it, and we don't know about that data. I also want to let you know that the number of emergencies that we see here is less than 2% per program. Obviously, if you have a program of 800 students, you are going to have more cases of emergencies, but also because of statistics, because the number is bigger. I just want to let you know very briefly the main issues that we see. As I was telling you, this is data from last academic course. We will update it with the data of this year, but just to let you know a bit, the main issue is about the stress and anxiety. After it, mood or depressive symptoms. Later, interpersonal conflicts, maybe not a mental health disorder, but interpersonal conflicts, problems about assertivity, problems with roommates, with friends, with families at home, host families. After it, we have attentional issues and learning difficulties, things related to ADHD or not, just focusing issues. After it, self-esteem issues, eating disorders, and others. And in others, we can include pre-existing conditions or things like trauma or other type autism or other type of pre-existing condition. But as I was telling you, the clinical picture that we have is not very different to the clinical picture of general population in Western countries. Next slide, please. Considering all of that, let's begin with this acronym that I was telling you, this idea of PACE, this idea of P-A-C-E. And the first thing that we are going to talk about is about prevention. Prevention, prevention, and prevention. We're always emphasizing it, but it's very important for 2 reasons. First of them, because it's going to mitigate some issues, it's going to decrease the severity of some problems, but it's also important for you because it's a way to be sure that you have all the resources, you have them available, and if things happen, it's not because we were not prepared, you know? So I think the part about prevention is super important. When we talk about prevention, we see different challenges. For example, the lack of necessary medication for their study abroad experience. This is an issue that is decreasing because I think that you program directors, you are doing a fantastic work telling students to please come to Europe with enough medication, especially when there is medication that we don't have available here, like the very known Adderall or things like that. Also, immediate desire or need to abandon the program when they arrive. We have been seeing this issue almost every year. Students that they think that the day they arrive here to Europe, they are going to feel fantastic. Everything is going to be wonderful. But the moment they arrive, because of different reasons, internal, external reasons, they are not having their best time. Maybe because of jet lag, maybe something happened to them when they arrive, whatever. And some of them, they feel the immediate need to go back home, to call their family, to cancel the experience. More challenges that we are seeing, some symptoms that they are coming from a pre-existing condition, then when they are here, they appear again. That is very common as well, that people, they think that when they have issues, if they change the country where they live, their problems, they are going to stay at home. And no, our problems, the problems of all of us, they travel with us. I think that we always tell is that maybe they don't come the first week or the first 2 weeks because we are very distracted, learning the new language, discovering the place, blah blah. But they will arrive later. Some potential solutions, some things that we would like to share with you. The importance of predeparture prevention. We know it's difficult. We really know it because sometimes the students, their families, they are doing paperwork, they are doing other things, they don't pay a lot of attention. But to try to have any type of brief or workshop or information or video or something like that, providing resources, offering resources, that would be very useful. For us, the ideal situation, and we have some cases every year, but it's not very common, to be honest, is when there are people that they already know that they need help, or that they at home they have that mental health support, and they can contact us before coming. And in the best of the scenarios, we can contact their clinicians, I mean, their psychologists, their psychiatrists, their doctors at home. We can have a brief call with them, always with their permission, of course, and we can transfer the case, you know. And once they arrive here, we know about them, we know about their needs, and everything is easier. And every time that we do that, the results, they have been fantastic. I understand that it's not very easy, that obviously is not under your control, but that would be the ideal situation. And at least we can inform families and students that if you have any type of pre-existing condition, we have these resources in Europe, and we can put you in contact with a professional who is registered to work in the country where you go. That is very important because in the European community, not all of us, we can work in all countries. I mean, for example, not just European community, also Europe. A person who has the license to work in UK cannot work in Spain, or a person who has the license to work in Spain, they cannot work in UK. And if something happens, the insurance is not going to cover it, and it could be an issue. So to explain families, to explain students that we can put you in contact with professionals, we can help you with it, that would be fantastic. It's true that later they can decide to use it or not, but at least to let them know. More potential solutions to emphasize the importance of bringing enough medication. As I was telling you, especially when the medication that they need is not available here. If we need other type of medication, we can get it in general. For example, with Adderall, psychiatrists, they can prescribe other medication and they can manage it. But the ideal situation is that they come with enough medication and they don't need to buy it here. And if they need to buy it here, as soon as they do it, the best, because we see lots of situations of students asking for an appointment for today or tomorrow because they don't have enough medication and they need the prescription. And sometimes we try to do our best with emergencies and to provide appointments in less than 24 hours if it's needed. But if we can manage it with more time, that would be great. And finally, prevention at the destination. During orientation sessions, during welcoming sessions, even if we have a lot of information, to provide a bit of information about these accessible resources, how we can help them if they need help about their mental health, even if they don't need help, but just to let them know that the day that we arrive or the week that we arrive, maybe we thought we were going to be super exciting and having a lot of fun, and maybe we are tired, we are confused, there are things about the city that we like, that we dislike. I think this prevention helps a lot to normalize it, to put words, to normalize experience. And in my experience, lots of cases when people, they understand things, they normalize them, symptoms, they reduce a lot, they can feel much better. So that would be great as well if we can work once they arrive here in prevention. For example, at my place, we offer different, they are absolutely free and optional welcome workshops that we go to your institution and we provide these workshops talking about mental health and study abroad, not just the difficulties, but also the great things about study abroad for our mental health, such as self-knowledge, creating more resilience, creating positive relationships. So just to summarize it, prevention if it's possible, pre-departure, offering the resources, trying to emphasize about enough medication, and finally prevention once they arrive here, even in very small doses. I understand that there is a lot of information, But little by little, more we say about it, more accessible is going to be in the mind of all of us, staff, faculty, students, professionals, providers, such as loitering. Next slide, please. After prevention, how not, we arrive to the states of adaptation. All of us, when we arrive to a new country, we have to adapt, and there are different barriers. The main barriers that we have been seeing, there are barriers like the language barrier, of course. And as I was telling you, there are more and more programs that they don't, in which the students, they don't study Spanish. So sometimes, or Italian or French, or the country in which they are. So that is one of the main issues. Cultural differences, obviously, differences in explicit norms or rules, but especially in implicit norms or rules. Implicit, like, for example, the way we have to communicate, to look to each other, these little things that some people, they can interpret it in the wrong way if they don't have enough context or enough information. Adaptation to host families, to the residences, to roommates. We see a lot of students that they were friends at home, but they were not living together. And when they come here and they start to live together, they start to feel some tensions and to have some issues. Microaggressions, one of the workshops that you are requesting the most, different programs to Mindplace, they are workshops about microaggressions for host families, faculty. That is very important because what we understand in some cultures as a microaggression is not what other cultures they understand. And microaggressions, a thing that we always say is that they can be a microaggression without intentionality. That maybe we say things that we don't want to hurt others, but others, they may feel hurt because of their culture, their background, their issues. They also have to adapt a different academic style, teaching style, that is maybe with a more direct way of talking, but maybe that is less specific, with less instructions, with a less clear rubric. These things, they may happen as well. And finally, how not, I think that we don't talk a lot about it, that adaptation back, to try to be aware of the reverse culture shock. Some potential solutions, at least to provide some knowledge, general knowledge about basic expressions, the importance of using them, how in different places when we use different expressions, for example, students that they are in Barcelona, let's imagine, if they learn a bit of Catalan and they can say hello, good morning, thank you, things like that, that is going to help them to connect. As well, to provide a bit of context about implicit and explicit norms and their origins. Why in some countries we have some sensitivities, some issues, and in other countries we have other sensitivities or other issues. More knowledge is more empowerment in general, and that is going to help to adapt. We can also talk about assertivity and communication skills. Obviously, I know that you cannot do all of this, okay? I'm just giving you some pills, some ideas, but it's interesting as well to try to work on how we communicate with each other, to do it in a way that is not confrontational, but it's not avoidant, to try to understand host families, students, faculty, how we explain things, how we talk about expectations, how we can be assertive, because lots of times when we communicate issues, when we can do a early and preventive communication, issues, they become smaller. And finally, the reverse culture shock, that sometimes we don't think about it, but a part of taking care of their mental health once they are back home, I think that it's important to show the value and to share the value of this experience abroad. Maybe to do at least, I don't know, one session, one little workshop, one little assignment or something like that about how this experience, they have been changing them, not just about their theoretical knowledge, but about their soft skills, their resiliency, their capacity to adapt. I think that would be fantastic because it's a way to also understand that if maybe in 10 years they go to live to Japan, to a country that is completely different, to a different culture, they have lots of skills and they have been learning things. And maybe they have, they become more open-minded because of the experience that they have been living. So I understand, and I want to repeat that you're very busy, you maybe cannot do all these things, but just some ideas, some things that they can help you when you are organizing the next academic course, or if you need help, of course, you can always contact us and we will be happy to help you. Next slide, please. Connection. This is the next challenge I would like to talk about, because it's surprising how many students, when they come to the clinic, to my place, when they talk to any of our therapists in our different locations, they talk about loneliness, and they talk about that they feel lonely, that they are around other people but they cannot connect with others. And some of them, because maybe of their personality traits, maybe they are not extroverts, and for them it's difficult to deal with big groups, and to create close relationships. Sometimes they also have difficulties to find the right resources, all these resources about professionals, about mental health that we were talking about in the P of prevention. After 1 month, 2 months, sometimes they don't remember how to access to them. They don't remember how they can find help. And finally, another issue that we find about connection is confidentiality and communication. That there are students or programs that maybe they can be worried about confidentiality, what is going to happen if a student is in risk, or the student can think what is going to happen if I ask for professional help, and later the therapist or the psychiatrist is going to tell my program that I should go back home or something like that. I think that is a challenge as well, and I think that we need to talk about it, and we need to talk about it, all of us. Some potential solutions for loneliness: to try to create low pressure structured spaces for connection. In lots of cases, as I was telling you, especially programs that they are quite big, maybe you're doing fantastic welcoming sessions, orientations, but for some students that they may be more introvert, they are more difficult. For them, it's more difficult to make friends. There are more and more programs as well that you have students studying abroad that is their first year in college, what you call freshman students, right? For these students, some of them maybe they have not the experience of making friends, and some of them they even verbalize, I don't know how to make friends. So to create smaller spaces, to create dynamics about team building, to create dynamics about the importance of positive relationships when we're studying abroad, that would be a great idea. I'm sure that you have also different providers that they organize different events, different activities, different trips, and things that maybe they can be done in smaller groups, and they can help the students that they are not extroverts and they need to find resources in smaller places. We have a list of some resources. You can always contact us and let us know if you need help about it. But I just want to let you know that loneliness and social dissatisfaction is one of the main predictors of mental health issues. In the same way that social well-being and satisfaction in relationships is one of the variables that correlates higher with mental health and satisfaction with life. So to be sure that people they feel that they can connect with others, that they make friends here, that would be very important. As I was telling you, we also need to be sure that resources they are available, that we have resources available for all students, and that they know where they can find resources. Because even if sometimes we do the pre-departure prevention, offering resources about mental health, even if sometimes we do the prevention workshops during the welcoming sessions or during orientations, even if we do all of it, as I was telling you, and I think it makes sense because they come here, they come to Europe, they are traveling around, they are discovering themselves, cities, lots of things are happening at home as well. So sometimes they don't remember how to access to different resources, and it's important that they have them, they can access to them, in my opinion, by their own as well. I know that they can always contact you, and in my experience, lots of the programs that we collaborate with, that some of you are here, some of the participants, um, You do a fantastic work helping us to schedule sessions with your students if they need them. But some people, they just want to schedule it by their own. So I think it'd be ideal if they also have that option. Things we can do to maybe put different testimonials, or even without real names or things like that, or different resources in places that they can find, things that they can find, that they are easy to them to find, and that maybe they don't need to do a lot of work to find it. Because especially in moments in which we are having a hard time, it's very difficult to ask about it, to maybe find the right information. And the third one, and one that is very tricky, is about confidentiality. In general, confidentiality can differ across cultures, but in the States and in Europe, it's basically the same. In healthcare, we can just, if they are older than 18, we can just break confidentiality if their life or the life of other people is in risk. And that is a thing that we are going to tell them when they ask for help, before they ask for help. It's a thing that we recommend you to tell them. And it's a thing that we are going to tell you as well, because sometimes you are worried about if this student is doing well or not, and you know that they are coming to us. A thing that we always tell you is that no news, good news, right? That if they would be in risk, we will tell you. Of course, we will tell you. We will tell them that we are going to tell you, but we will, because the first thing that we need to preserve is their physical health, and that they are doing well. So, of course, it's important to let them know that we have this confidentiality. This confidentiality could be, we can break it if we see that they could be in risk, or the life of other people, they are in risk. But again, I think it's important to remind it, because it's very common that they ask about it. How is confidentiality here? It's the same that in the States. There are some norms that they are a bit different, but in general, it's the same. We can just break it when their life or the life of other people is in risk, and we all need to know about it. A thing that we can always do, a thing that we recommend them to do, if, for example, let's imagine that they have any type of mental health condition that is it's making difficult for them to perform well in their academics, is to tell them that they can ask us for a report, a clinical report, in which, of course, we are going to be very professional and very honest, but we will write the report for the student, and later the student, as an adult, can send you the report, or can use the report as they consider, and depending on the norms of the university, because I know that lots of programs or universities for academic or learning accommodations, they need the report from the university, the university at home. But that is the maximum that we can do if their life is not in risk. And it's important to let them know that they can feel completely free, they can feel completely okay asking for help, because we are not going to break that confidentiality unless their life would be in risk. So summarizing here, the importance of creating connection, creating maybe little spaces for introverts that they can connect, to have resources available, that they know how they can find professionals, how they can find help, and finally, to let know about confidentiality, and about that they can feel completely free if they ask for help, and they will be in a space free of judgment. Next slide, please. Next slide. Thank you. And finally, emergency, a thing that I was telling you, is not very common when we go back to our statistics. I was telling you that around 12.5% of students, they ask for help. And I just want to emphasize that the majority of them, they have it completely covered by their insurance. We work directly with direct billing with the majority of insurance. So they have it covered. They don't have to pay for it. But I can let you know that they don't overuse the service. That people that they ask for help, it's because they really need help. As I was telling you, is in general around 10% of students who are asking for help. And of these 12.5%, maybe a total of just 2% of students, they show real emergencies or problems that they are crisis and in which we need to manage a crisis. And as I was telling you at the beginning, obviously, if you have bigger numbers, if you have more students, because of the statistics, it's more probable that you are going to have some of these emergencies. But we need to be realistic that they are not very common. What are we talking about when we talk about emergencies? Which are the challenges? Obviously, suicidal attempts, also trauma, or what is called vicarious trauma, to be an observer of the trauma. Maybe they were not the victim, but they were there in the moment, or they were with a friend of them. That is very common, for example, in cases of sexual assault, that maybe it happens to a friend of them, but they were helping them, they were going with them to the police station to report it, and they experienced this vicarious trauma. Other issues, tragedies at home. Every year we have cases of students that something happened at home, a person of their family, they commit suicide, or they pass away in an accident, or something happened, or they get sick. That could be another example of emergency. Violence or robbery with or without violence, that they don't feel safe, that something happens. And we need to understand that when we're in another country, everything becomes more difficult, even if we can get help about the language and all of it. Everything is going to be more difficult because we don't know the implicit and explicit norms and rules, and everything is going to be more stressful. Obviously, cases of sexual assault, that from our data, they are decreasing. And I think that is because in general programs, you are doing a fantastic job talking about it, trying to help students to be aware about it. But every year we have some cases about it as well. And other issues, for example, about previous PTSD, post-traumatic stress disorder, and triggers that maybe they find when they come here, or the abuse of substances, or problems with other students, or other issues that they may happen during the time that they are here. Some of the things we want to share with you. Obviously, we can do everything we were talking about before. We can work a lot on prevention. We can talk about on helping them to connect with each other, to create friendships, to connect with the right professionals. We can also help them to adapt to the country, to adapt to the host family. And doing that, we are always going to mitigate a lot this type of situations. But a part of it, once it happens, once the event happens, I think one of the things important is to understand that intuition is not enough in cases of crisis. I know that lots of you have a lot of intuition because you have been working in this context, in this field of study abroad during several years. But what we know from science and from psychology is that intuition works best in familiar but also predictable context. And when we are facing cultural differences, trauma, or things like that, maybe we have a lot of knowledge, maybe we know a lot about this field, but these situations, they are not very predictable. Each person is going to react in a different way. And that's why intuition is great, it's fantastic. Maybe sometimes you are talking to a student, or a student is talking about another student, and you say, hey, maybe I should talk to this student. I'm not sure about what's happening. Maybe I need to talk to them. Maybe I need to talk to a professional about it. And it's fine, and that's great. But we cannot just follow our intuition, and that's why the step number 2, I think it's very important to have protocols. Protocols save lives, but only if staff know about them and they trust them. I think it's important to have protocols, and obviously you are not. Some of you, maybe you already have them, others you don't, and you are not going to develop them completely from today to tomorrow. But I think it's important to have some protocols of what is going to happen if, for example, something like there is a suicide or a suicidal attempt or a case of trauma or something like that. What we are going to do, how we are going to communicate, with who we are going to communicate. In the case of sexual assault, the hospitals with students they can go. For example, the example of Spain, they can go, but they are not going to receive the legal attention if they don't go to a public hospital. Even if they have a private insurance for sexual assault, they need to go to a public hospital, so they activate the legal protocol. To know these things, to know about them, to be sure that the staff, they know about it, they know the steps. That is going to be a way to at least make the situation less difficult, to know how to communicate, with who to communicate, to ask for help. Recently, I remember that a director of a program was telling me that was worried about the mental health of a student. And we were talking about the conversation she could have with this student, and she did. At the end, everything was fine. It was okay. But I think it's very important to understand it, that even for us, that we are professionals, we need protocols. We cannot just follow our intuition, because every person reacts in a different way, because each trauma means different things for different people. And it's important to have protocols, but also to be trained in these protocols. We have protocols, but we just have them. But staff, they are not trained about it. They don't know about it. They are not familiar with these protocols. It's more difficult to activate them and to to behave from security and confidence in these moments. When this type of things happen, what students they are going to need is a figure that is going to show that validation, of course, that support, but also some security. And protocols, they are giving us that security. And I know that lots of you have them, but I think it's important that all of you know about them, you're familiar with them, and that we can collaborate in case you need it, of course. Next slide. And with that, we have been talking about the 4 essentials. I know that they are not so essentials. I mean, I know that there are more things we can do, but I just wanted to give you some little pills about what we know, what we do for prevention, adaptation, connection, and how to manage emergencies. And we have 15 minutes before to finish this session. So I would like to give you time also to ask questions, to participate, and to share what works for you and the issues and potential solutions that you have been seeing during your experience. Thank you very much.
Thank you, Letty. Please, those of you participants, feel free to open your mic and do the question, or you can type it on the chat section and we can read your question. But if just to break the ice, I have a question. So regarding confidentiality, if we know that the student needs support from you, because either the student mentioned to their parents to the university, and then the university to us, and we procured or we referred that student to you, but we are not sure if the student has contacted you or not, or if he's just going to the sessions or not. Should we kind of like do a follow-up? Should we ask you? Should we ask the student? I know it breaks with confidentiality a little bit, but it's on the other side, we are worried at the same time.
Yeah, we always try to be flexible when we know you're very worried, and we try to collaborate very close to you. But I think that we always recommend, in this case, for example, if it's going to be through email, is to put the student in copy, because lots of the times they are going to respond and they are going to say, yes, I'm coming, I'm receiving sessions, or maybe they're going to say, sorry, I forgot to to reply, and they are going to reply. Once they do it, of course, we can reply as well. We have no problem about it and about being flexible, but I think it's important we include the student, because it's a way to take care of confidentiality, So that is a thing that we recommend you to do, that we understand that you're very worried, that you need the information, but they are adults. And to say who is coming to a session is a way to break confidentiality as well, So that is a thing that we are always going to recommend you to put them in copy, and we are always going to wait until they respond. 90% of the times they do, and later we just can continue. Did they respond you?
Okay, yes, thank you very much. Thank you very
Thanks
much.
to you.
There's a question on the chat. It says, how many months of prescription medicine can a student enter Spain with? Adderall, etc. Can annual year students bring enough
Yeah,
from Romania?
if they have the prescription, if they are going to come with more than maybe 2 boxes of pills, they need not just a prescription but a report as well of the doctor. But if they travel with a report, they can come with enough medication. That is not a problem, The main issue that they face, in my experience, is that sometimes their doctors at home, they don't want to give them that prescription. They tell them, no, I'm giving you the following prescription in the next appointment. It's important that they emphasize that they are going to be studying abroad and they can try to get it. Just to let you know, I know students that they have been traveling with a lot of medication, and with the prescriptions and the clinical reports, they had no problem at the airport. The main issue is not to enter in the country with enough medication, because if they have the legal documents, it's not a problem. The main issue is to get it at home, that their doctors, they give them enough prescription. As I was telling you, it's ideal situation. If they cannot get it when they are at home, obviously we are going to find the medication that is more similar. Sometimes it's the same. The case of Adderall is different, but in other cases, it's the same generic medication but with a different commercial name. We are going to help them. But again, the sooner the better. If they know that they are arriving with not enough medication, we always recommend them to ask for an appointment, that it can be even an online appointment with our psychiatrist, to get the prescription so they are sure that they have enough medication. Laura, could you please advise on the recommended number of sessions for a student who is experiencing difficulties or wishing to seek assistance? The recommended number of sessions, I guess that you are asking about it because of the insurance, that some insurances, they ask about the number of sessions. Okay, great. Depending on the case, that is a very good question, because I think that people, they deserve to know the approximately number of sessions that they need, because or their insurance cover it, or because maybe they are paying for it. Depending on the case, I was telling you our average is like 6 sessions, but it depends on the case. For example, what we know from our statistics and science is that in cases of anxiety, it is an average of 8 sessions. In cases of mood disorders, depression, in general, it's an average of 12 sessions. So it depends a lot on the case. But for students that they are studying here and it's a chronic condition, in general, for a semester, it's around 12 sessions. If it's a condition that is more chronic, if it's a more normal condition, if it's something that is easier, around 6. I mean, the half of it. Thanks, you, Laura.
Thank you.
How about US students? Does it include the European health card or just private insurance? That's a very good question, because with the European health card, they can go to public health. The thing is that in public health, it happens for people that we are from Spain as well, is that it doesn't cover mental health very well. It covers mental health in general in cases of crisis, for example, for hospitalization or things like that. But when it's about asking for help, I mean, therapy sessions, it's difficult even in Spanish, and as far as I know, in Italy, it's very similar, it's difficult even in the language of the country. So in general, they need a private insurance. It's true that lots of private insurance, sometimes they don't, if they are European, American insurance in general, they cover it directly, and the work with them is very, very easy. At least for us, it's very, very easy. For European private insurance, like for example, could be the case of AXA, other cases, sometimes they don't, we cannot bill them directly, but they can pay for it, and later they can ask for reimbursement. And in general, it works very well. If we can do direct billing, we always prefer it, because for students it's easier and we are used to do it. But in general, if we cannot do it, they are going to reimburse at least some part of it. I don't know if there are more questions or if you just want to ask. Thanks to you, Ella.
I think there's no more questions, but again, well, we will share with the video of the recording of the session. But you can contact us. Feel free to contact us, either Leti, which is the expert on mental health, or us, that we provide support services for students and programs. And lastly, probably those of you who are American programs or American-based programs, or have colleagues or are based in the US, next May, by the end of May, both of us, Letty and Lodgerin, some staff from Lodgerin, we are attending NAFSA annual conference in San Diego. So you can visit us. Lodgerin will have a booth 1143, and we can search for us, and we can have a meeting over there in San Diego as well.
And Saul, if I can respond to Amelia and Ella, that they were asking a couple of questions. And you're talking about, Amelia, it's a very good question. Why students, they don't report previous mental health incidents when they apply? To be completely honest, I think that some of them is because they don't think about it. They just do the paperwork as fast as possible. But there are others that they are worried about, that maybe, and they tell us in session, that maybe they are not going to allow them to come if they talk about it when they apply. I think here it's important, maybe when you are preparing the paper for applications, to explain it. I mean that there are chronic conditions about mental health that they are absolutely okay with going abroad. To give you an example, autism, bipolar disorder, if they are well medicated, if they have enough care, it's fine. I mean, sometimes we have people that for them, the experience is much easier than for other people that they don't have pre-existing conditions. So it's important they know that if they have any pre-existing condition, they can come, but it's important that is regulated, that they are getting enough help, that they can continue with help when they are abroad, and that you can help them to connect. I think that when we create these safe spaces, it's more probable that they are going to share it, and to talk about that there are chronic conditions like diabetes, like physical conditions, that they are absolutely fine with a sign abroad. A different thing is if they are living a crisis, and maybe in that case they should think about it, or they are suffering from any type of addiction. In these cases, in cases in which it's not very well controlled, if they are living a depression or something like that, maybe it's not their time to come, maybe it's another time. But if it's a chronic condition, I think it's fine to let them know that it's fine, that they can come, and that they can find help. And in our experience, students that they do it, they are the students that they have less issues. And when you are asking about workshops, Saul said, yes, we do. We offer always a welcome workshop when the students they arrive. That is very short, during orientation, 20 minutes, depending on the time that you give us. And it's very, very brief, but we also offer other type of workshops. So you can contact us, and we can send you the catalog of different workshops that we offer, such as study abroad as a transformational experience, mindful eating, positive relationships, resiliency, stress for exams and performance, things like that. And thanks to all of you, and thanks to Saul, I will go to NAFSA as well. So maybe I will see some of you there too. So I hope I can see you again. And as I was telling you, anything you need, let's get in touch, okay? And let's continue learning from each other. Thank you very much to all of you for your participation, and thanks to Lodgerin again.
Thank you. Thank you everyone for attending this webinar. We are planning to. This is the first of some others coming. We don't want to do much or very frequent. We don't want to bore you, but we do want to do more webinars with experts in the field, that experts that collaborate with us, experts partners that we have alliances with, in order to provide the support services to our to the programs and the students that collaborate with Lord. Have an amazing day. Thank you, and I hope this brief pills that Letty mentioned will be helpful for your programs. Thank you. Have a good day. Thank you, Letty.
Thanks you. Bye bye.
Thank you
Have
so
a good day.